Good evening, everyone. I'm Tseguereda Abraham, Head of Advocacy and System Strengthening in WaterAid Ethiopia. I'm going to present for you the practical experience from the SusWASH program in Ethiopia. In this program, we are working in Gololcha woreda, East Valley zone of Oromia region, at community schools and healthcare facilities level, from the district level to the zone, region, and national levels. We have tried to address in this project the different components of the WASH system to bring inclusive universal access to WASH. The primary components we addressed are the coordination and integration, strategic planning, financing, service delivery and behavior change, accountability and regulation. As a secondary focus, we also targeted the different components such as active, empowered people and communities, gender, and social inclusion, institutional arrangements, and government leadership. The building blocks interact with each other and they overlap, and we are working to strengthen the relationship between the people and the institutions within the system, not just the separate static building block. So what are we doing to strengthen the WASH system? We have supported strategic planning based on in-depth analysis of service levels and life cycle costing. We facilitated WASH sector coordination. We co-created a mechanism to monitor service delivery. We have demonstrated and delivered WASH services in schools, health facilities, and water supply services in 3 communities. We also contributed to strengthening accountability mechanisms using Making Rights Real tools. We contributed to building district capacity to meet existing and future water demands, and also strengthening management of utilities and rural water boards. There are significant changes we have observed in this program. Water supply services are being well managed under new management models that were introduced. Users are now more willing to pay for water and call out illegal connections. The district WASH team is established, has clear roles and responsibilities, and meets regularly to coordinate WASH activities. There is also an increased understanding and application of the National Equity and Inclusion Guidelines at the district level. So what have we learned so far? We learned that demonstrating service delivery models help build government buy-in for broader system strengthening initiatives. Despite efforts to attract additional funding to major maintenance priorities remain cited on extending coverage. Although this is understandable in an area where coverage is very low, we still need to advocate for investment on sustaining existing facilities. We also have learned successful customer forums and users accountability platforms are strongly related to service availability. We learned that Making Rights Real tools facilitated constructive and continuous dialogue with government about human rights principles without being divisive or confrontational. Thank you very much for listening.